All right, welcome. It is April and it is IBS Awareness Month. And this is an opportunity to do a little preventative health care, learn how to advocate for your health, and really understand that you should not be suffering in any aspect of your life, especially when it comes to your physical being. And so I want to talk about who I am. I'm an interventional health practitioner. I have my bachelor's degree in dietetics, my master's of science degree in integrative and functional nutrition. I'm also a trained chef. I'm a fitness professional, and I'm a patient advocate. I really do help people shift their lifestyle and be able to advocate for their health so that we can live a long, healthy, independent, joyful life. And so I want to make sure you understand that this webinar is not intended to give you medical advice. This webinar is simply an opportunity to educate you with information to better advocate for your health, give you the tools to be able to go talk to your provider about things that are bothering you in terms of your health, and especially when we're talking about irritable bowel syndrome. So let's get right to it. So what is irritable bowel syndrome? Also known as IBS. It is one of the most common disorders of the large intestine. And if you take a peek at that visual right there, really it encompasses the entire abdomen from both, your top of your, the top of your rib cage to, the bottom of your pelvis. I mean, this whole entire area is really some area that can cause so much pain. And IBS symptoms can include stomach pain, diarrhea, stomach bloating, constipation, cramping, and really so much more. I really wanted to get a more in-depth list for you. So if you're suffering from any of these symptoms, belly pain, cramping in the stomach, gas, bloating or swelling of your belly, changes in your stool, bowel movements, diarrhea, do you have loose stools, constipation, do you have hard stools or trouble passing stool, an urgent need to use the bathroom when having bowel movements. And sometimes people with IBS will pass mucus with their stool. So any one or combination of these things, really, if they're bothering you and they're lasting for a period of time, need to be addressed with your healthcare provider. And I really want to indicate that if you have bleeding, fever, weight loss, or severe pain that does not go away, these are not symptoms of IBS and may suggest other problems, and you need to talk to your doctor, aka your healthcare provider, right away if you have any of these particular symptoms. So again, let's delve into more about what is irritable bowel syndrome. Well, it's a health issue found in your intestines, the gut. And while the cause of IBS is unknown, which is so frustrating, it can still be treated. Okay, IBS is a common health issue impacting more than 35 million Americans. It does not cause lasting harm to the bowels. It does not lead to intestinal bleeding or cancer. So that's important to really clearly state. There is no sign of disease when the colon is looked at through colonoscopy. And much like a headache or a muscle strain, IBS can cause a great deal of pain and distress even though it cannot be seen. And this is where, we'll get into all the aspects of irritable bowel syndrome. And while it's a disease we consider of elimination, there is not necessarily one particular test that says you have IBS. It's kind of eliminating all kinds of things and then coming up with this syndrome. So important to identify what your IBS is. Are you IBS with constipation? Do you have IBS with diarrhea, or do you have an alternating constipation diarrhea scenario in your realm? And so specifically when we talk about IBSD with diarrhea, you may often have loose stool, makes sense. You may often feel an urgent need to move your bowels. Sometimes people have no control, like when they get that feel, if they are not in the bathroom within seconds or minutes, they may lose their bowels. And of course, this is devastating on all aspects. You may often cramp or have belly pain. So that's the diagnosis as IBS-D. IBS-C is IBS with constipation. You might find it hard to move your bowels. You may not often move your bowels, and you may have an urgent need to go, but cannot go. And sometimes when constipation gets so bad that the stool can actually block, become this gate at the anus, and it looks like diarrhea because the stool behind this block wall, literally of stool, gets forced around it, and it can look like diarrhea. And when it's really a really intensive chronic constipation. And then we do have those individuals who have IBS-M, which is IBS mixed, and you'll have symptoms kind of alternating of both diarrhea and constipation. So here's the deal. You don't have to suffer. IBS can impact not only you physically with all that intense gut pain, but it can impact you emotionally, the worry that comes with it, and socially, where you won't even want to go to events or go out in public because you don't know when you will have to use the bathroom, how much pain you're going to be in, etc. Most people with IBS are able to control their symptoms through diet, through stress management, and sometimes with medication prescribed by their health care professionals. All right, so suffering is not in the mix here, my friends. What's most important for me to teach you, and I teach this to every single client that I work with, is the fact that you should have providers that allow you to participate in shared decision making. All right, I'm looking you in the eyes because I really want to communicate with you the fact that the great path to improve patient, that's you and I, satisfaction, is the ability to be able to communicate with our healthcare providers, which could be an MD, a DO, a PA, a physician's assistant, a nurse practitioner. All of those are providers who might be seeing you on their own to help guide your healthcare. So I want you to understand what the shared decision making should look like for you. You should be, and they should be, seeking participation. All right, in the conversation. Like, you should be participating with your physician in the conversation. All right. Helping you, your physician should help you explore and compare treatment options. All right. So it is not about them saying, we're going to do this. It is about, this is what I believe is going on. This is what I think might help you. Let's have a discussion. How do you feel about this? Assessing your values and preferences. Like, everybody's different. Some people want to be very proactive with their situations, and others really want to put their head in the sand. And so it's important for your provider to understand that and to take that into account. It's important that you make decisions, you reach decisions together. You and your healthcare provider come up with the decision. Yes, we feel like it's a good idea to try this medication. Yes, I think it's a good idea that we do a colonoscopy first. Maybe we should see, have an evaluation by a nutrition professional, right? So all of these things have to happen with shared decision making. And finally, evaluating your decision together, right? All right, so we feel like, on a scale of 1 to 10, we should go after this first, this second, and at the end of it all, if we don't get this solved, we're going to do this. All right, so there is what we'll say a game plan. If you want to get to the Super Bowl, there's got to be a game plan. If we want to improve your health, there has to be a game plan as well. So I want to give you an idea of what happens when you go see your gastroenterologist. I think this is really important for you. Your doctor will ask you detailed questions about your symptoms. And it's important for you to be specific. Your healthcare provider is not a mind reader. They cannot possibly assume your symptoms. And so you really should, prior to your appointment, because we all know in today's age that you will be waiting for a period of time before you actually get to see your provider, you should be keeping a log, whether you do it on your smart device, or whether you use a good old pad of paper, whatever it is for you, or logging in on your computer, whatever is best for you. But you really need to have a little bit of a timeline for your provider to be able to say, this has happened every single day for a week, or this has been happening to me 2 or 3 days for the last 3 months, but that you actually can track your symptoms to help you be able to give your provider more detailed information so that they can better help you in a timely manner. The last thing you want them to do is to send you home and to say, can you please keep track of your symptoms for me and what you've been eating while you get those symptoms, rather than you coming in well armed with that information at your first appointment. They will do a physical examination. They will feel your entire abdomen because there's so many organs there that they want to assess that you're not having other issues that you might assume is the IBS, when it could be any number of things. They're going to take a full medical history to see if anybody else in your family has GI issues, because so many disease processes are heritable. So we really want to have these conversations as well. And your doctor at that point may decide to do a blood test. If they have any indication that you might have something called celiac disease, which is a gluten allergy, not an intolerance, an allergy, which means it needs to be identified, they may do a blood test that can identify if you are one of these individuals with celiac disease. They will definitely, they may do a physical exam, again, feeling your belly. In all cases, that's likely going to happen. And they may actually do a stool test, because they're looking for things like parasites and other different situations that might be going on. Again, depending on your story. Has there been travel? Did you have any issues with what you thought was maybe norovirus or vomiting or diarrhea or different things that you could have been exposed to? And then it's really important, based on the results of the blood tests or stool tests that you might have, that you may end up needing additional tests. And those include a colonoscopy, which is where they look from the bottom up through the top of the intestines, or an endoscopy, where they look from the top down to the top of the intestines as well. So they're looking into the esophagus and the stomach and such. If there are no other health issues are found, we have to identify the fact that you are having symptoms of IBS, the cramping, the belly pain, the loose stools, the problems passing stool. And if you have these more than 3 times a month for the past 3 months, and they are interfering with your life, your doctor may conclude, remember we talked about a diagnosis of elimination, that you truly do have irritable bowel syndrome. Now, I want to just reiterate the fact that irritable bowel syndrome is very different than IBD, which is irritable bowel disease, which are 2 specific disease processes. One is Crohn's disease and the other is ulcerative colitis. These are very easily identified through symptomology, definitely identified through colonoscopy, blood tests as well, very specific disease processes. And again, that will take you out of the realm of IBS, moving you into the IBD world, irritable bowel diseases, 2 of them, ulcerative colitis and Crohn's disease. Very, very different and differently treated because of the ramifications of what those disease processes cause for the long haul than IBD, which we really talked about, or excuse me, than IBS, which we talked about, doesn't really cause more than symptoms. And again, the symptoms and all that goes with IBS are really damaging for you psychologically, socially, and certainly physically. But unlike IBD, those individuals have very specific treatment protocols because it can lead to really serious complications. We do not see that with IBS. I guess there's one good thing at the end of that rainbow. But it's important to understand what the treatments look like for somebody with IBS. We talk about things like diet and nutrition management. We talk about medical management, and we talk about behavioral management, which might be somewhat surprising for some of you. So again, I want to just reiterate the importance of that shared decision-making with you and your provider. And if you do not feel heard, it is important that you seek a second and even perhaps third opinion until you find a healthcare provider who is willing to listen, who is willing to take your family history, your own story, your information that you're providing about what's happening of recent with your life. And that way, together, you will be able to make a decision on how to better help you heal. So when we talk about the treatment options, let's talk immediately about diet and nutrition management, which is where I'm going to come in, and we're going to delve in that a little bit. But right now, we're just giving you generalized information because I want to fill up your tool belt. I want you, if you feel like you're somebody who might have IBS, then I want you to understand the situation clearly so that when you talk to your healthcare provider, you are well armed, you're well informed, so that you understand what is spoken to you and that you're able to clearly ask questions and feel like you're being heard. So it's important to understand how important diet approach is. Many people say that they feel like their IBS symptoms occur after meals. And many people, for many people, eating a proper diet, all right, having what I want to say normal portions, not necessarily small portions, but portions that are appropriate to most individuals, and eating a more healthy, more plant-based, not plant-exclusive diet may help lessen your IBS symptoms. All right. So that is a thought. All right. Before changing your diet, and this is critical, before you make changes, we need to keep a record, a food journal. And again, it can be on your phone. It could be simply taking pictures of your food. That could be the easiest way. It could be having a little a document on your computer. You could simply use good old pen and paper, where you're going to know which foods seem to cause what symptoms. And then you're able to share this information with not only your provider, but perhaps with a nutrition professional. But I think even better for you to do is really to do a complete food journal, and not a food journal recall where you think, oh, what did I have, yesterday? I would say today I had whole grain toast with peanut butter and sliced banana and a glass of low-fat milk. That is what I would say a food diary should be. It does not have to have quantities, but it should give a very clear indication of what you're eating. And then, perhaps following that meal, you felt fine, but then at lunchtime, perhaps you, went to a local sandwich shop. You had perhaps the Italian bread. Perhaps you had the Italian sliced meats, and you can list those down there. Perhaps you had mayonnaise or mustard or whatever. Maybe you had a bag of chips. And then following that meal, you had gas or bloating, or you had to run to the bathroom, or whatever that looked like. That would be a really good way to provide information for your healthcare provider so that they can start to look at that, especially your nutrition professional, to see if they can kind of put a picture together. I have clients all the time who come to me with bowel or gut distress. And they'll say, oh, when I eat onion, like that's the offender. Or if I drink milk, that's the offender. And the issue is this: we don't eat usually one food at a time, right? We eat a combination of foods called meals and snacks. And so while in your mind, you may have this confirmation bias that dairy or onion or garlic or certain foods might be the offender, really, it can be something completely different. But because you're not a nutrition professional and you're not looking at it the way we might, you might not even notice that, this combination might be the problem, or different things like that. So the more information that you can provide, the better in a food journal. And even if it's only happening a couple times a month, if it is something that you notice and that you think, oh my gosh, I'm so afraid to eat, or I'm so afraid to go out, you need to be keeping a very clear record of what you're consuming. Again, easiest way, pictures of everything you're putting in your mouth, and perhaps a little note on your smartphone where you can say, on this day I felt this way. But really important for the evaluation and to be able to help solve the issue, because as I mentioned, we're looking for IBS is a disease of an elimination, right? So we've got to make sure that we're not looking at really horrific big bad guys, and then we can dial it down to potentially IBS. In the the GI world, I guess I'm not going to say it today, dairy products, and high fat foods often, they'll often say they cause issues in some, but not all. So I'm glad that's clarified. So it's really important why that's stated. Now, number one, dairy products, which could be low fat or non-fat, can also be really full of fat. Even your 2%, milk is very high in fat, even though it says 2%. It's 2% by weight, but really in reality, it's about 36% fat. And then you move on up the chain from there. We might think about things like pizza, where we might have white flour, more refined crusts, and then we're putting pizza on cheese on top of that, and then we're putting things like pepperoni and sausage. So now we have this extremely high fat meal that could certainly cause issues for anyone, but that's why dairy products kind of get demonized here. But I really want to indicate it could be more of the high fat foods, and then the combination of foods, not necessarily one or the other, okay? Because you certainly can be using a fat-free dairy product and have a lactose intolerant, which is completely different than IBS. So again, we just want to evaluate what's happening, and a food diary journal will really help that, okay? But it's not an automatic, and I think what's important, we're going to talk about in a little bit, is that I really want to encourage food inclusion rather than food exclusion. And when we get into gut issues of all kinds, everybody wants to get rid of food. And here's another perfect example of that. So, recently of current times, IBS patients have lessened their symptoms with a low FODMAP diet. And so we'll talk about that for a moment. So FODMAP refers to a group of 5 sugars that are in certain foods: lactose, fructose, which is fruit sugar, fructans, galactans, and polyols. And certain food items, if they're poorly absorbed, are broken down by bacteria to cause symptoms like gas and bloating and swelling of the belly, belly pain, loose stools. So in a lot of the nutrition world, immediately for patients who, we think they might have some kind of IBS or other gut disease, distress, things like dairy are removed from their life, gluten are removed from their life, and then, they're put on this low FODMAP diet, or people put themselves on this low FODMAP diet on their own. The problem is that that was not what the low FODMAP diet was established for. The low FODMAP diet was used for people who have gut distress, so gut issues, not just IBS. And it's a way of trying to start small with food stuff that we know is less problematic for individuals at large. And it is used as something where we add food to it. Some people just think, well, I'm going to just live on a low FODMAP diet. The problem is it takes away all kinds of food stuff. We're going to lose nutrition. We're often going to be malnourished because we're not getting the nutrients we need. We're going to be deprived because it is a very punitive and restrictive approach as well. And it is simply a tool that is used when we're trying to help people alleviate their gut pain, but it is not meant as a diet approach for the long haul. The same thing with removing dairy products and things like that. And certainly there's lots of high fat foods like olive oils and nuts and seeds and avocado that are really wholesome foods that should be included and can be included in your diet if you enjoy them, but it's really about portion size. So I'll say I get a little defensive when statements are made like this, but I want to give you clarity as to why it might be used with your nutrition professional. But again, I'm really one of food inclusion over exclusion, starting with more real wholesome food. And really, if we're going to eliminate anything, I talk about eliminating the highly processed, ultra processed foods and getting back to the basics. All right, what food originally looked like is a great starting point. So you'll want to talk to your doctor or registered dietitian or other qualified nutrition professionals. So we have to be very careful out there. I am not a registered dietitian nutritionist, but I practice like one. I'll say that I'm oftentimes more educated than registered dietitians who have bachelor's degrees, but they also had clinical training, which I did not at that point in my life back in the 80s. But my master's degree in integrative and functional nutrition has really allowed me to be able to put the science and evidence on the plate of wholesome food. The problem we're seeing out there in the nutrition space is that there are many people who have very little, if no training, and call themselves nutritionists. And this is hugely problematic because oftentimes they're pulling information out of the internet, out of thin air. And there's a lot of supplementation going on, a lot of taking away exclusion of foods. And really, we want to be able to use a beautiful whole food, mostly plants. Shall I say that again? You don't have to be a vegetarian and you do not need to be a vegan unless you choose to be, but we do need to encourage more plants in our lives. And I think this picture right here for you is a very clear picture of the type of foods that you certainly could include in your life, regardless of what's going on with your gut now and in the future. The other area that we really need to talk about is medical management. And this is one of the most difficult areas for our healthcare providers because we don't have a panacea. In other words, we don't have a medication that's going to solve all your problems. That is why we have this integrative approach, right? It's multifaceted, where we're talking about dietary and nutrition management. We're talking about medical management. There may be things to help you in the moment, perhaps some rescue medications, that paired with a little behavioral management. And this is where we really do feel that we can help people eliminate their distress caused from IBS. So when we talk about medications, it's important really to talk about for IBD, you know, the diarrhea aspect of it. There are over-the-counter as well as prescription medications that can be used to lessen or stop in the loose stools. And this is where we worry about people getting dehydrated. This is where we're concerned about you not wanting to go to social events, going out in public because of the diarrhea being so uncontrollable. And this is where medications, over-the-counter and prescription, may help you get back to a more normal semblance of life. So I want to really reiterate that to you. When we talk about IBS-C with constipation, again, over-the-counter or prescription medications may fiber supplements as well, stool softeners, laxatives, and other types of medications may help to stimulate motility, getting things moving, and the secretions of fluid in the intestines. They may be used to help lessen or stop constipation. So really important to understand that you may be an individual who may gain some lessening of symptoms and pain and issues with constipation by using some of these medications. They are, shall we call them Band-Aids? They're not something that we're going to use forever, but in the time being, until we get the testing done, until we start to work on your nutrition approach, until we potentially think about the psychological piece to this, these are things that can help quell your symptoms, which will allow you to be a normal human being again. Now, I like to mention this when we talk about probiotics, like probiotics get thrown at people all the time. I was just at my orthopedic doctor yesterday, and I have an issue from a surgery, so we're going to have to go back in and do a little clean out. But they put me on high doses of antibiotics, and he's like, "Oh, you may want to take a probiotic." Now he just threw that at me, right? Like, take a probiotic. So what do? Do I just go to the pharmacy? Do I ask a friend? Do I ask the pharmacist? Do I just pick up the cheapest one, the most expensive one, the one that has the trillions and billions of probiotics available to me? And this is where it's not really a solution to throw that out to our patients, but it's really important for you to understand, working with a nutritional professional, that we can actually gain probiotics, live cultures, live bacteria, by consuming them through wholesome, real foods. And this is why a qualified nutrition professional will be really useful for you. The more we can populate our gut with the good guys, but again, we don't want to overpopulate. So I'll tell you, when we look at these pills you can take, ranging from a few bucks to, probably hundreds of dollars, they're going to give you potentially trillions of these good guys. The problem is, even if they're good, you bring too many people into your house, you're not going to be able to feed them. People are going to get angry with each other. There's not going to be enough space, and we're going to have problems. So I just want to give you that heads up. Don't think that, again, the probiotic pill, potion, supplement is going to be your panacea as well. It's really important to talk to a qualified nutrition professional about, how to increase the healthy bacteria in your gut, those probiotics, and how potentially you could do it with food. Important to know that sometimes antibiotics will be used. But again, we know that we want to not develop resistance to antibiotics. So antibiotics should be used, again, with shared decision-making when it is to help and to do more help than harm. All right, this is a balancing act here. It's also understanding, this is aside from the psychological piece, that antidepressants and antispasm drugs can be used when stomach pain is really bad. And again, we're trying to put you in a situation where you can go back to your normal routine in life and not be stuck in bed, stuck in the bathroom, not wanting to leave the house. So any combination of these new, these things that we talked about here. Plus, there are lots of clinical trials going on right now that are trialing new medications. And you can simply go to clinicaltrials.gov, put in IBS, Irritable Bowel Syndrome, and see if there are any trials taking place by you. I'm a huge fan of clinical trials. I was in my first clinical trial back in college, when I didn't know it, but I was taking what is now naproxen sodium because I had the most severe cramps my entire young adulthood with my periods. And I will tell you that I definitely got the drug, and it has helped me through my entire, how long did I have my period? 45 years having a period every month, except when I was pregnant. That naproxen sodium really, which is Aleve, really helped my cramps. It is considered a prostaglandin inhibitor. So, and I was just in the Novavax clinical trial for COVID. So we need participants, and it is a great way to potentially help not only yourself, but humankind at large. And then lastly, most people don't know that the behavioral management is definitely an area that most people don't even consider when we're talking about gut distress, right? Potential irritable bowel syndrome. But we now know very clearly that this is an area that we cannot ignore. But I will tell you that people really want to leave the brain, the mind, the psychological piece of all aspects of life out of it, but we really cannot. So it's really important to understand that, having a good behavioral therapist and understanding that the gut and the brain speak to one another in terms of food and hunger, emotions and stress. And I always say to people, when you are anxious, where do you feel anxious? And you feel anxious right here, which is the start of your gut, right? This is your stomach. And so it is very clear that there is a clear connection to anxiety and stress within your gut. And so it's important you to understand that there are several psychological treatments that can help reduce the symptoms of IBS, including things like cognitive behavioral therapy. I'm a huge fan. Hypnosis, stress management, meditation, and other types of relaxation methods. These treatments seem to lessen stomach pain and the mental distress linked to IBS symptoms, improve coping skills, and help patients adapt to their symptoms. And by the way, these things can help you in so many areas of your life. So you will be getting more bang for your buck than to just have to deal with your IBS symptoms. There are no harmful effects, and these treatments can be used in addition to or instead of usual medical treatments. And you certainly should talk to your doctor or healthcare plan to put you in touch with mental health care professionals that fit into your insurance plan and that can help you as well. So again, this is for you to understand the three components: diet and nutrition, right? Medical management, and then the psychological aspect of IBS. And the fact is, you don't have to suffer. So it's really important when you see your provider, you need to ask questions. Will I need to do other tests in the future, right? What if my treatment isn't working? How long should I wait to tell you if I'm having symptoms? And are there symptoms that should cause worry? And if so, what are they? And what's great today, and I certainly would advocate for you that if your healthcare provider doesn't have a portal where you can easily access them at any time or day and night, and that you will have a response back either from the provider or somebody within their team within 24 hours, and you really might consider looking elsewhere, because that is really the way of 2023 and beyond, that you have access to your providers within 24 hours when something is not emergent. And certainly a phone call at any point in time or call to 911 might need to suffice as well. And then I think it's really important, when I talk about the psychosocial aspects of this, is IBS impacts not only your physical, but also your emotional well-being. And we need to own this and hold it, right? There is actual physical pain, right? With that, we have feelings of sadness. Why me? How could this be happening again, right? You're worrying about, is my IBS going to get worse? Is it going to happen again? When will it happen again? You might feel that, because of the symptoms and what's happening in your life, that you're not able to care for your family, which feels awful. You feel ill at times. You feel hopelessness at times. You can feel, have nervousness and anxiety at times. And certainly when you're feeling awful, you might lack energy, and you certainly can lack satisfaction within your sex life. And so we have to realize that your ability to sleep can be impacted, your ability to work can be impacted. And so it's not something to just let slide. I can't even communicate how I've had clients, family, friends who have really let significant life-altering symptoms of their gut go on for years on end. And just thinking that they should be able to solve it themselves, or maybe they're making up, or maybe it's not as bad as they think it is. The fact is that you deserve to feel well, you deserve to feel good. And if anything lingers, for, a couple of weeks and you're not having relief, that is when it is time to make that call and schedule that appointment with your provider. And if you have a primary care or an internist, it is a great opportunity to just send a message to the portal and let them know your symptoms so that they can make the assessment of whether you need to move on to a specialist like a gastroenterologist, or whether you should simply have some testing before you even come in to see them. All right. But then again, it is up to you to communicate this to your healthcare providers and to be an advocate for yourself. And so, of course, Mama G certainly can't be in the picture and not have you spend a little time considering the value of a healthy eating pattern. So again, I'm going to communicate who I am and what I do. And really what I value is the concept of conviviality, the ability to gather with family and friends and enjoy the food you're consuming, and put the devices away and have conversations. And really, I love the concept of bringing the family back around the kitchen table. And I will tell you, I feel like I've got one of the hardest jobs in the world, because it is easier to change a man's religion than it is to change his diet, said Margaret Mead, and I agree with her. So I wanted to share with you some freebies that I offer, and then we'll talk a little bit more about some nutrition, and potentially if you have any interest in working with me in the future. So we do offer a complimentary weekly newsletter where we keep you up to date on what freebies are happening in the month. For instance, this month we have our IBS webinar. Last month was colorectal cancer month. We did a webinar on that, which we can provide for you. We'll have all those archived for you. February was Cardiovascular Heart Health Awareness Month. We did a webinar on that this month as well, because so many people tell me how much they hate to cook. We're doing So You Hate to Cook, so let's cook once and enjoy more than twice. So we have a 4-week webinar series happening as well, and we will be also doing a cook along at the end of the month, where you can come virtually in the Mama G's kitchen, and we will cook a beautiful, nutritious, mostly important, delicious meal together, and we provide free recipes every month and so much more to you. So if you're interested in our complimentary newsletter, you can go to our website at mamagslifestyle.com, and realize at any point in time that you don't want to receive that newsletter anymore. At the bottom of the newsletter, it says unsubscribe. You can just take care of that at any point in time, but that will keep you abreast of our freebies. And then every month we address what is the awareness topic of the month that is so important, that usually collides with nutrition and health. I also, for people who just are interested in working with Mama G, but that are really a little bit nervous about something more formal, we have a Taste of Mama G Recipe Club. We have a beautiful virtual recipe library. You'll get access to little videos I do in my kitchen to help you understand how to bring more wholesome food into your life, and to really learn to love the concept of cooking, not only for yourself, for the people you love, and to be able to role model healthy behaviors that will allow us all to live that long, healthy, independent, joyful life. And then for those of you who are really just sick and tired of being sick and tired, a few times a year, 3 times a year, I run a 12-week virtual group program where 12 weeks, twice a week, we come together live. All of our all of our videos, our sessions are recorded, I should say, because you may not, your schedule may not fit mine, but the goal is to educate our clients on science and evidence-based nutrition, and then as well teach you how to get inspired in the kitchen to allow you to hit your calorie budget, because so many of my clients, really want to lose the weight for good. They're sick and tired of the punitive and restrictive diet approaches, and I want you to just understand the value of wholesome food, how to be able to enjoy food, understand portion sizes, allow you to lose the weight for good, or gain the weight, or maintain your weight, whatever it needs to be in your life, and role model those beautiful behaviors for your family and friends as well. And so let's get on to the education now. So as I mentioned, I really like to talk about food inclusion rather than food exclusion. We talked about 2 approaches within the GI world where we see them taking away things like dairy, taking away things like high-fat food. Now, again, I'm all about the ultra-processed, highly processed food stuff, the saturated fats and stuff. Like, we're going to exclude those things for the most part, but we're not going to take away wholesome food choices unless we really understand that you have an allergy to those things. And those are, we have ways of figuring all those things out, but really it's about going back to real wholesome food and seeing value in the nutritional value, the ability to balance your blood sugar, the ability to reduce your risk of heart disease and stroke and colorectal cancers and high blood pressure, and so much more. So really, we're talking about that healthy eating pattern. And I want you to understand that while a healthy eating pattern majority of the time is going to, revolve around a lot of plants and, some beautiful lean proteins and dairy and plant-based proteins or whatever floats your boat, it also should be able to include treats and splurges, but they are on occasion, not necessarily something you're consuming on a daily basis. And certainly we want to try to build some willpower and resiliency and to not get into, disordered eating with binging and purging and, so many hugely problematic eating problems that we've gotten ourselves into with all the dieting and the restrictive and the punitive approaches out there. And we're going to be sharing for you our healthy black breakfast plate. So this is a Mama G healthy breakfast plate, really wanting to reiterate to you the value of incorporating a multitude of type of foods for you. So we think about something like whole grains and starches that are not refined. And so we can think about things like this whole grain toast breakfast, where we've got, this grainy toast. We've got some peanut butter, which just could contain just a little salt. We don't need any other added ingredients. You may use an all fruit spread or some sliced fruit like bananas on top of there. And then we would partner that, because this is really lacking in protein. We partner that with a protein-rich calcium source. It could be a low-fat, non-fat dairy. It could be a plant-based protein. There's lots of options that could be to hit the marks for not only your calories, but your nutritional value as well. We can look at something like a fruit smoothie, but I'll tell you what's usually missing within those fruit smoothies, and that is a starch or grain. So I'm really a big fan of throwing things like rolled oats into this at the end of the blender, right? The high-speed blending. You don't even know they're there, but they're giving you a nice dose of fiber in there, and it thickens this up a little bit. We want to make sure that we have a protein-rich calcium serving in here. And again, we can look at low-fat, non-fat dairy. We can look at pea protein beverages, soy beverages, things like that are also rich in calcium. We want to add some healthy fats in here, so you can certainly add nut butters or nuts or things like chia or flax seeds or hemp seeds in here. And then certainly your favorite fruits. And I'm a big fan of frozen fruits. I think this is a great opportunity to have frozen fruits in your freezer, and you get this beautiful, nice, delicious fruit smoothie. I think when we look at something like a bowl of oatmeal, it could be really lacking in nutrition. I think it's really important that you consider a protein-rich calcium serving to cook your oatmeal in, and it can be steel-cut oats or rolled oats, whatever floats your boat, but that protein-rich calcium serving, and it's kind of outlined here on the bottom. And so you'll be getting a copy of this in the follow-up email with the link to this webinar. Will help us to boost the protein within this. We certainly want to include some beautiful fruit, whatever you enjoy. I love to cook my oatmeal with date crumbles. They literally meld into the oatmeal, and they make it taste like caramel, which is delicious. Again, you can use your favorite nuts or seeds like chia or hemp or flax, or I love walnuts in mine with a little dash of cinnamon. And now we have this beautiful, wholesome breakfast. And then one of my favorite, which is why it's called Mama G's Euro, is where we take, and I prefer non-fat plain Greek yogurt. We use a little muesli, which is just rolled oats or wheat and nuts and seeds paired with your favorite, again, nut or seed. Mine is walnuts. And your favorite fruit of the season. I eat this wherever I go, all over the world, and it is fantastic. But over to the left here, you can see we can always want to include a water-based beverage with all of our meals and snacks to help not only keep us hydrated, but fill us up as well. And then for breakfast, especially because these tend to be more vegetarian or vegan-based meals, right? We're not eating animal protein or animal meat products per se for breakfast. It's a great opportunity to include that protein-rich calcium serving, whether it's within the food stuff, or maybe you might have a tea latte or a coffee latte, or just a nice tall glass of your PRC to enjoy with that breakfast. The other thing that I want to show you and we'll be sharing with you is our healthy plate. Again, this is more targeted toward the typical lunch or dinner that we eat, very different than the standard American diet, which is SAD, S-A-D, because our food stuff doesn't typically look like this. We really want to focus on the plants, and you can see that 3/4 of this plate is highlighted with plants, right? And it certainly could be all plants if you want to move into the vegetarian, especially vegan space. But in this case, we really want to get a nice dose portion of non-starchy vegetables. And in Mama G's world, nobody else's world, perhaps someday if I have a Wikipedia, it'll tell you that the only vegetables that Mama G tosses into the starchy carbohydrate group is potatoes, sweet potato, corn, peas, and most hard-shelled squashes. You could have them, my friends, but we're going to toss them up into the right corner. Otherwise, we're talking about all other vegetables, single vegetables, combination of vegetables, roasted, raw, sauteed, steamed, whatever floats your boat. We always want to make sure that you enjoy a starchy grain or a carbohydrate in here. Again, this is where those starchy vegetables come in, but they also include things like whole grains and whole wheat and chickpeas and lentils and beans and pastas and tortillas and so much more for you. Again, 1/4 of your plate, smaller portion for you, but you get to include it. It brings joy, it brings fiber, it brings nutrients. And then, of course, we cannot forget the value of protein. We're always going to want to focus on lean proteins, especially when we're looking at meat products, poultry products, where we want to remove skin. We want to choose leaner cuts. But when we're looking at things like fatty fishes, like salmon, we want to enjoy those as well because they are dosed with omega-3 fatty acids, which promote heart health and so much more. But again, everything is about portion size. It's a small portion. It's 1/4 the size of your plate. This is where Mama G really dials in portion sizes with her clients, especially with those clients who are trying to hit a weight goal, gaining weight, losing weight, maintaining weight, whatever that might be in your life. And then again, importantly, to remember that we want to include healthy fats, right? Olive oils and nuts and seeds and avocado really can add so much joy to the cooking process, to your plate in general. You'll see off to the right here, we talk about that water-based beverage. I suggest at every meal and snack that you have a cup or a mug of some kind of water-based beverage. Not only will it keep you full, but it will also hydrate you. And you never have to say to me, but Mama G, I'm not getting enough water. You will, not only within the plants that you're eating that provide water to us, but within these water-based beverages. I always encourage my clients, and I'll encourage you as well on that bottom left-hand corner, that most days, I would love to see more berries in your life, more leafy greens, more legumes, which are things like beans, chickpeas, and lentils, and digestives. Digestives are some of those things that might contain probiotics. We see this in things like Greek yogurt. Read the label and you'll see that active cultures are added to it. We might see this in something called kombucha, which active cultures are part of this. We might see this in some vinegars. We see this in fermented vegetables. So again, there are nice ways that we can populate the gut with these digestives that help to really aid in a good defense within that gut as well. And then lastly, you'll see in that right-hand corner, we talk about the value of protein-rich calcium sources at breakfast. And we didn't talk about snacks, but I'm a real fan of getting 2 snacks in throughout your day and including a protein-rich calcium source. I think another fruit source would be great, some nuts or seeds, and you're going to not only enjoy that meal, it's going to fill you up in between meals, and it'll help you to be satisfied not only within the snack itself and meals itself, but it'll give you satiation from meal to meal and meal to snack, which will help the binging, the late night eating, etc. That is really problematic for so many of us. And, you know, this is the reality of the aging process, right? I've got a grandson who's getting ready to walk. But, we really want to keep moving throughout our life, however many years we are blessed, and we want to be able to stay moving on our feet. So really, this is what my goal is for all of us. And, in our senior years, given that I'm turning 60 here in a few days, this is what I want for my senior years, and I want it for your senior years, regardless of how old you are today. I want to just share with you the integrative model of the 4 pillars of health, which I think are really important. I think it's important to nourish our bodies, as a chef and a nutrition expert. I think it's really valuable to be able to eat food, consume food, using it as a thought as medicine, and choosing a lot of whole plant foods to start and throughout our days. I think movement is really important. We'll talk about in a minute the value of exercise. I think the value of connecting with people. Social connections are really important with supportive and loving people. And I think it's really important that we're able to restore ourselves with quality sleep and stress management throughout the day. So I think this is a really valuable group of pillars to live by. And then we're also going to send you this, which is put out by the American Heart Association at heart.org, which talks about the value of exercise. When we're talking about IBS, I think it's critically important for you to understand that motility of the gut is helped through physical exercise. And regardless of what you're doing today, step 1 for everybody should be able to get into a walking program. And whether you're walking for 5 minutes or whether you're walking for an hour, depending on what you're capable of, the goal will be 150 minutes or more per week of a moderate intensity exercise. And for so many of us, it could just be walking. And then, the value of being able to move more and sitting less. Lots of people want to talk about steps. And I will tell you that I'm not a real fan of talking about steps. I mean, yesterday I went to Legoland with my granddaughter. I mean, if I looked at my, my device, I could see that I did lots of steps, but I will tell you that it didn't increase my heart rate. I wasn't sweating. I wasn't out of breath. It was very different than the run I did yesterday morning before I went to Legoland. And I'm not saying that you need to be running or climbing mountains or doing, what neighbors, friends, or even I'm doing. What I think there is value in is the value of consistent exercise in your life, not only for your gut health, but for your overall health. Hence why this is put out by the American Heart Association and recommended by every major World Health Organization to move more and sit less, right? So increase your steps that way, but it is not in replacement of that moderate intensity exercise. As time goes on, you're able to add more intensity, which is going to only behoove your cardiovascular and pulmonary health, as well as your bone health. We also talk about adding muscle mass. So this, at some point, I encourage my clients to get into a strength program. And again, initially, it can just be body weight, and it can be at a gym, it can be at home, it can be in so many different aspects. And then you will understand that you will begin to feel better dramatically. So that is where we're going to end things. Imagine that I'm actually hitting it right on the hour. If you have any crazy pressing questions, you're welcome to put those into the Q&A bar. But again, just want to really thank all of you for joining this webinar on irritable bowel syndrome. It is really a disabling syndrome that so many people suffer with. And we really want to be able to help you help yourself in no more suffering. So really encouraging you. We'll have this link for you. We'll send some information to you as well for you to reach out to your provider. Certainly starting with your primary care, your internist is a logical place to begin, but ultimately conversation will likely be had, an appointment be made with your gastroenterologist. I also want to remind you, since we're coming off of colorectal cancer month last month, that at the age of 45, that is the new age, it is the new 50, 45 is the new 50, in terms of first screening colonoscopies. At that point in time, following your first colonoscopy, if you've had no polyps, you are moving into the 10-year screening plan. If you have some polyps, but they are not concerning, you move into the 5-year plan. But if you're like Mama G, you get to have your colonoscopy every 3 years. But again, preventative screening through colonoscopy will save lives. Colon cancer is the #2 cancer killer, yet it is the most preventable cancer because of colorectal screening. Unfortunately, not enough people understand it. Perhaps not enough people value it and take it seriously. All right, my friends, if you don't know it yet, you know what Mama G always says, it's not about what you lose. It's all about what you gain. Think about getting on our website and signing up for our 4-week webinar series. So I hate to cook, and I say, let's cook once and enjoy more than twice. We will be week 2 tomorrow, and we will be sure to send you week 1 if you're interested. Enjoy.